Hi, this is Dr. Kevin Smith with Red Apple Wellness and Chiropractic. I'd like to welcome you to this presentation of what do you do when your back hurts and the medications aren't working. A guide to pain-free solutions to acute and chronic spinal pain. I'd like to introduce myself briefly. My name is Dr. Kevin Smith and I'm a doctor of chiropractic. I'm the author of the book Modern Chiropractic: The Way to a Pain-Free Lifestyle. I've been in practice since 2001. I practice in the South Hills of Pittsburgh, and I'm the developer of Mass Correction. Now, what we're going to cover in this brief video is the most common causes of back pain, what you need to do to get rid of your pain, and we're going to cover why the medications generally won't fix back pain. So, what are the common causes of back pain? The most common causes of back pain are due to a lack of motion, abnormal posture, and weakness and instability in the spine. We can also add a fourth reason, which is trauma. However, you're going to find that most of the time, chronic back pain is not caused by trauma. It is generally caused by these three problems: lack of motion, abnormal posture, and weakness or instability in the spine. Now, when you go to your medical doctor with a complaint of back pain, the doctor is inevitably going to give you some kind of a medication. These medications are going to come in the form of either NSAIDs, which stands for non-steroidal anti-inflammatory drugs, such as ibuprofen or even aspirin. They may prescribe muscle relaxers, such as Flexerol. They may give you steroid injections or prescribe narcotic strength pain relief. Now, the reason why these medications don't fix the problem is because they will not actually address the root cause of the problem, which, as I said before, is due to a lack of motion, abnormal posture, or weakness or instability in your spine. All these medications really do is to mask your symptoms, giving you some perhaps temporary relief and not much else. So the first way to fix back pain is to restore your motion. And that involves getting your muscles moving correctly, getting those joints moving correctly, and correcting any kind of abnormal movement patterns. Now, the way that we accomplish this is by a very carefully prescribed prescription of chiropractic adjustments, gentle stretches, and other things to enhance and improve the flexibility in your joints and your muscles. Once we've been able to accomplish restoring your motion, the next key component to this is to restore the alignment. And the way that we restore your alignment is to fix the posture. The posture involves correcting the alignment of the spine and the pelvis. And this is very important. The reason why it's important is because we're under the force of gravity all the time, 24 hours a day, 7 days a week. And what you want to do is to minimize the stress, the gravitational stress on your muscles and your joints. If you take a look at this image, the image on the right, where that skeleton has some forward head posture and the pelvis is out of alignment, that's going to cause stress and strain on all the joints and the muscles and even the discs in the spine. Now, no amount of working out and certainly no magical pill is going to fix that. You have to get the body lined up correctly. Once we've accomplished the restoration of movement and alignment, the third key component is to restore strength to your body. And the way that we do that is we will prescribe exercises. Exercises that are specific to where you may have some weaknesses. And that is, we arrive at that conclusion by way of testing you to find out where you have some instability problems or where you may have some muscle weaknesses. The only way to do that is to do a proper examination. So the restoration of the strength focuses on increasing your spinal stability, your functional strength, and your endurance. At Red Apple Wellness and Chiropractic, we do a technique called MASS correction. MASS is an acronym that stands for Motion, Alignment, and Strength. We restore motion, alignment, and strength for the permanent relief of back pain. This is the new gold standard in physical medicine. Before we can accomplish that, though, we have to do a couple things beforehand to find out where the problem is, the extent of the problem, and if there's any kind of complicating factors. So the way that we do this is to do a consultation where you come in and meet with me for 10 to 15 minutes, go over all the different complaints and all the parameters of the problems, and then we do a very specific and focused examination that is designed to check orthopedic tests, neurological tests. We check the range of motion, the posture, all the different components of the spine to make sure that everything's functioning correctly. We check your motion, your alignment, and we, of course, test your strength. Once we know what's wrong with you, then we can prescribe corrective exercises, adjustments, therapies, home care strategies, and even lifestyle changes. We have a very effective approach that's powerful, it's all natural, it's non-toxic and non-invasive, and it works. So if you've been suffering with back pain, give me a call to find out how I can help you get rid of your pain. Give me a call at 412-212-8880. You can also visit me online at redapplewellness.net, and if you come visit my website, you can get free access to my ebook on how to get rid of chronic pain. Thank you very much for checking out this video.